Now, the final part of the discussion I wanted to talk about is sort of the factors contributing to the PPG signals. And these include various factors here. And there are many sources of variations of PPG. This includes individual variability, including skin tone, obesity, age, and gender. There are physiological factors, some of which I've mentioned before, such as respiration and venous pulsations, body site, and body temperature. There's external perturbations such as motion artifact, ambient light, applied skin pressure, and also design differences in hardware and software inconsistencies that occur across the different devices. And so a study that nicely assessed the effects of these factors on PPG-derived heart rate and heart HRV was done by Jessalyn Dunn's group at Duke. And her group evaluated 4 consumer wearables and 2 research-grade wearables and assessed the effects of skin tone and activity on the heart rate and heart rate variability accuracy. And what she found in summary on this plot was that basically the device type did matter, that some devices were better for heart rate accuracies. She also found that activity can diminish heart rate accuracy by up to 30%, but that skin tone really did not change the accuracy of heart rate and heart rate variability. And I wanted to go a little bit into the details of this. So you could see an example of the effect of motion or motion artifact on PPG. So you can see the motion here, it does affect the PPG signal. And we are going through the signal processing to extract the pulse rate or the beat to beat interval. The algorithm mistakenly thinks that there is an additional beat here. And so there is a mistakenly assumption that heart rate increases. So you can see that the quality during this time diminishes. And this is very similar to sort of the confidence interval, the confidence score that is provided to us in collaboration with Garmin using our platform. And you can kind of see here the effects of activity on the quality of the signals. And what we see here is the mean deviation error using EKG as a gold standard in various physical activities, including breathing, resting, typing on a keyboard, and walking. And it can be seen here that Apple Watch does quite well, followed by Garmin and Fitbit. And interestingly, the research grade devices did much worse than anticipated. And so the research grades are here demarcated by the light blue section here. And I want you also to be aware, though, that much of this data may not be relevant anymore because the Garmin watch that was used during the study was a VS3 or VivoSmart 3, which is several generations removed away from our current VivoSmart 5. And it's also of note is that the Apple Watch is, $400, or when the Garmin watches are about $100 or so. And so I think some of these things need to be considered as well. Now, this graph from Jessalyn's study showed the effects of skin tone on heart rate at both at rest and activity. And the way you assess skin tone is by the Fitzpatrick scale. Basically, it goes from 1 to 6, 6 being the highest density of the melanin content in your skin. And you could see sort of during rest and activity that the skin tone really does not affect the mean absolute error for when you're doing these comparisons. And then when you're actually assessing by device, again, Apple did the best, followed by Fitbit and Garmin. And again, the Empatico and Bioevolution, which are these research grade watches, wearables, didn't do as well. And then when it comes to heart rate variability, the same sort of conclusion, skin tone does not affect heart rate variability. Now, what about oxygen saturation? And that's a completely different story. And this was a study that was published in New England Journal in 2020. And I think it received a lot of publicity because it was at the time of COVID. And it was a study done at University of Michigan where they had about 10,000 measurements obtained from floor and ICU patients. And these patients had a paired SpO2, so basically oxygen saturation derived from a PPG device, and actual blood determined oxygen saturation, so using an ABG and arterial blood gas. And what they wanted to do was they wanted to assess the rates of cold hypoxemia. So hypoxemia is defined as an SaO2 of less than 88%. and being occult if the SpO2 or the PPG device showing what's considered normal. And you can see kind of this here in this graph here, the arterial oxygen saturation obtained from the blood, and then sort of the 88% demarcating whether it's hypoxic or not. And you can see that, and then the bottom here is the pulse oximeter. And you can see the anticipated sort of relationship should be based on this dashed line here. And you can see the differences between white and black patients. And you can see that the black patients in general have a lower amount of SpO2 compared to the white patients. And so this, I think the conclusion was that there are higher rates of occult hypoxemia in the black patients compared to white patients. But this graph also indicated to me another thing. And you could see even in white individuals, white patients here, even with, a reading of 92% using a PPG, there are a number of patients here who actually had low amounts of arterial oxygen levels. And so the surface PPGs may not actually be accurate in both black and white patients in certain patients. And there's no way you could predict that. And so that's some of the note of caution that you have to have here. So I'm nearing the end here. So you may be asking, so how does this make any sense? So you're telling me that heart rate and heart rate variability is not affected by skin tone, but oxygen saturation is? And how does that make sense? Since heart rate and heart rate variability uses green light, which we know is sensitive to melanin absorption, and SpO2 uses red light, which is theoretically less sensitive to melanin absorption. Well, it all has to do with the derivation of these measures. So while the green PPG signal is indeed diminished by melanin, the pulse rate is determined by the peak of the PPG signal. So this determination is really not that affected by the amplitude of the PPG signal. And so the beat to beat intervals between these two tone colors may actually not be all that different. For oxygen saturation, however, the melanin in the darker tone individuals does affect the absorption of the red light more than the infrared light, which then affects the proportion of the red and infrared signals that then leads to the alterations in the calculated oxygen saturation. And so this is why, skin tone can affect heart rate and can affect oxygen saturation, but less so heart rate and heart rate variability. So here are some final practical recommendations for you when it comes to obtaining PPG-derived heart rate and heart rate variability and oxygen saturation. First thing, I really encourage a tight fit. I've seen many patients who use watches, or study participants using these watches, and you could see the light leak out underneath the watch. That indicates that the fit is not good enough. And I've seen participants sort of complain that the red light is sort of waking them up in the middle of the night. That indicates that the fit is too loose and that you have to sort of make it tighter. The other thing that you need to consider is that there has to be adequate pressure of the watch onto the skin. And the ideal sort of level is about 15 to 20 millimeters of mercury. And the reason that has to do with the fact that actually the optimal signal is when the pressure matches the arteriolar or capillary pressures under the skin. It just has to do with the dynamics of that. And so you want to make sure that this is snug enough, but that doesn't really cause a significant skin indentation caused by the watch. The other thing to consider is that you should ideally keep the skin warm. I've seen studies being done in very cold room temperatures, and the PPG signals actually diminishes quite a bit. So try to keep the skin warm, and if you can't control that, I've considered using a warming device, maybe like a cloth or a sock around the watch to keep the skin warm. The other thing, which is pretty obvious, is to minimize movement if possible, also to keep hydrated. And then the other thing that we found is a little bit of a hack is to turn on the pulse ox, at least for the Garmin watches. It seems that when you turn on the pulse ox, which causes the red light to turn on, it also causes the green light intensity to increase as well. And so turning on the pulse ox may actually increase the quality of the heart rate and heart rate variability measures, but with the understanding that it could significantly drain the battery, as mentioned before.